before the administration of the any anesthetic agent, first perform two pre-anesthetic evaluations. So pre-anesthetic evaluation must be performed before the administration of the any drugs. So it is a very important slide for how to evaluate the animals and how to prepare the animal for the administration of the drugs and how to evaluate the animals. So pre-anesthetic evaluations will be performed by obtaining the pre-operative history and regarding journals and physicals, the status of the animals, and biochemical analysis of the animals. So through proper the patient evaluations and preparations will helpful for the improving the patient safety and ensure the successful anesthetic outcome. So pre-anesthetic evaluations has great influence on the dose and choice of the anesthetic agent and also the the technique. First evaluation is the point is the history, starting from the history. So durations and illness of the determine the which type of the anesthetic is required. So duration and nature of the illness is determined the duration and type of the anesthetic requirement. So patient with the renal and the hepatic failures means affected with the renal and hepatic affections require the close monitoring during the anesthesia. Means both the systems are compromised, so close monitoring must be required. So one person spare for such type of the patients, and prefer the generally general anesthesia. So such patients are not administer injectable anesthesia because it is risky procedure. So generally prefer the inhalation anesthesia. And patient with the history of the epilepsy should not be used the phenothiazine derivatives. So if your animal is some history of epilepsy, so generally not prefer the phenothiazine derivatives. Otherwise, produce some it decrease the thresholds of the epilepsies. The second one is the signalment. So signalment regarding the case, the records, then breed, then age, sex, this details about the animals. So detail identifications about the animals. Even the duration of the illness will be recorded properly and will be properly recorded, so not possible to accidentally administration of the anesthetic drugs in wrong animals. So many times it has happened when misidentification of the animals, even the misidentification of the drugs. So wrong drug is administered in higher dose in other animals. So such type of the accidental, if you don't want, then you take the perfect history and perfectly mention it. Then third point is the feeding and watering. So feed withdrawal period is generally recommended at least for the 6 to 12 hours in canine patients. So minimum the 6 to 12 hour withdrawal of the food is followed, and water withdrawal period is recommended for the 6 hours in canines, even in the felines, particularly in the plant surgeries. If the animal owner is not follow, many times animal owner not follow such the instruction of the clinicians. If you not follow the instructions of food and water withdrawal, then they increase the risk of the incidence of the vomisons after inductions of the anesthesia. And its recovery periods during the recovery, many times so during recovery periods, and increase the risk of the tracheal aspirations. So it creates the problem. So this point first discuss with the animal's owner before the signature on consent form. So the proper means strictly follow the rules and regulations regarding the pre-anesthetic evaluations and preparations. So means give the instruction to the animal owner. So minimum the 6 to 12 hour food withdrawal period and 6 hour water withdrawal period. Generally in the neonatal, this the same instructions not follow in the neonatal patients. So because of their high metabolic demand causes the possibility of the hypoglycemia. And the water withdrawal should not be limited in patients, particularly in the renal affected animals, means kidney affected animals, even during the high ambient environment and temperature. So particularly the water withdrawals is not followed in neonatal as well as in renal affected animals, even in the during the high summer seasons. So in other seasons you can follow in the adult animals strictly. It reduces the chances of the vomisons and reduce the chances of the tracheal aspirations. Now come on the relative size of the patients. So anesthetic dose should be on the basis of the milligram per kg body weight. So the calculation of the anesthetic means loading of anesthesia totally depend upon the body weight. So the proper weight of the animals, no underweight, no overweight. So as far as possible to give the exact idea regarding the weight of the animals. So proper weight of the animals. So it is not a laborious work. It is very easily do it in the animals, small animal practice. So small animals have the higher metabolic rate than large animals, large size. So hence the large dose of anesthesia is required in small animals because the BMR is high as compared to the large breeds. So particularly in speed and even the Pomeranians, even the pugs. So these are the small breeds. So BMR of this breed is very high. So dose is definitely the dose, BMR is high, so dose is higher. So it's quickly metabolized in the livers. So higher dose is required in the smaller breed as compared to the larger breed, particularly Great Dane, Rottweilers, even the Boxers. So require the lesser dose as compared to the small animals, small breeds. Next one point is the species. So species difference is play the vital role in anesthesia. That may prevent the use of certain drugs. So certain drugs cannot administration in certain species. So for example wise, the morphine is contraindicated in cat. So if you give the morphine in cat, so cat is excited. Cat is excited. So don't use this certain drugs in certain species. Then considering the breed of animals, so play the roles. So breed is play the very good role in anesthesia, and certain breed is very risky regarding the anesthesia. Example was brachycephalic breeds. So brachycephalic breed like the bulldogs and pug. Pug is famous for the all over the world due to the hutch, but these animals are extremely prone to the airway obstruction. It is very risky breed, very risky breed regarding the anesthesia. So first when the pug is come in your clinic for any surgical procedures, so first fill the consent forms and aware the animal owner regarding the risk. So why this animal is more risky regarding the anesthesia? Certain anatomy is responsible for that. Which anatomy is responsible for that? So pug, the size of the mare is very small. So coma safe mare. So the flow of the air is obstructed starting from the mare. This coma safe, small narrow opening is there. These are the first point. The second point is the track of the neck is a short neck. The length is very short. So the volume, the tidal volumes means the volume of the air is less, means reserve volume is less in pug because the short neck, then elongated. Third point is elongated soft palate. So when you give the any anesthetic drug, so relax this elongated soft palate. So it's means relax, due to the relaxation is close the opening of the trachea. So the airway obstruction is most commonly seen in the pug. So how to reduce the risk of the anesthesia in this, because this breed is routinely coming in your clinics. So you don't away from this breed. So how to reduce the risk of anesthesia in this breed? Very easily reduce the risk in this breed. So we are routinely perform the operation in pug. So cataract in corneal related surgery, means the deep ulcers, your superficial ulcers, many times the grafting is there. So generally the most common requires the general anesthesia in this species. So reduce the risk of anesthesia is by the rapid inductions. So the quickly you induce the drugs, then rapidly endotracheal intubations. Endotracheal intubation is must be performed in brachycephalic breeds. So rapidly intubations, not slowly you perform the endotracheal intubations. So once you give the induction dose, induce the animals, then rapidly you introduce the endotracheal tubes and the quick supply of the oxygen. So this 3 point is very important for reducing the risk of the anesthesia in these breeds. Very easily you can manage it, not any mortality noticed in your clinics. So since the 10 years, I have performed a lot of the operations in this species, but hardly the 2 animals that died due to the anesthesia. The rate is very less as compared to the real data of the US. So in the US, so 10,000 animals performed for the surgical intervention, means the 10,000 animals anesthetized, and out of these 10,000, so 648 animals died due to the anesthesia. So as compared to the US, our data is very less. So I am happy. So second one is the greyhound. So these breeds show the prolonged recovery periods. So when using thiopentones anesthesia, because it decrease the body fat. So it is greyhound is a lean animal. So if you give the thiopentone in this species, so recovery period is higher. So this is a breed, these are the breed specific some points. So evolution is very important. So German Shepherds, the Boxers, Great Danes have increased the sensitivity of the central nervous system depression. But generally, don't worry about this species. But these 2 species is very important, and particularly brachycephalic breed is more prone to the airway obstructions. So this point considers. So now the next one is the age factor. So anesthesia in very young animals is subjected with the higher risk. In the young animals is with the higher risk due to the limited size, limited musculature, limited adipose tissue. These are the helpful for the metabolize and excretion mechanism. Generally, these are the systems are underdeveloped in the young animals. So that's why. So generally in the young animals, so injectable anesthesia is not preferred. Generally, they prefer the inhalation anesthesia. So they particularly neonatals generally metabolize and excrete drugs less efficiently than adults. So generally prefer the inhalation anesthesia as compared to the injectable. Then old patients have a decreased anesthetic requirements, so less amount of the anesthesia is required. So this point is also kept. So animal is a neonate, your animal is old, your animal is adult. So on the basis of these 3 types, you can increase your dose, you decrease your dose, your optimum dose. So slow in old patients, in the aged animals, so slowly metabolize it and slowly excrete it. So with the prolonged effect. So less dose is required. So in this species, the patients, old patients, so generally prefer the inhalation and safer for the inhalation anesthesia. And finally consider the sex of animals. So sex factor. In males, so BMR is higher, approximately 7% is higher than females. So male is required the higher amount of the anesthesia as compared to the female. But in pregnant females, the BMR is higher due to the pregnancy, due to the activity of the metabolic activity of the fetus. So they require the higher dose as compared to the non-pregnant female, But male is generally require higher And in female animals, particularly pregnancy animals, require a higher dose because the BMR is higher. Those are fetal activities. So, physical status of the animal. So, this is a funny slide. The physical status of the animals is determined by the body scoring scale of the animals, and identify the either animal is obese, overweight, underweight, or lean animals. So on the basis of this body scoring, so you can decide the dose of the, and means grading of the risk regarding factor. So obese animals have the lower BMR per unit of the body weight and need the less anesthetic than the lean, the musculature animals in the good condition. So now come on the general status of the animals. So general status of the animals will be evaluated by the clinical and laboratory examination of the animals. So this evaluations generally performed at a OPD level. So first to clinical examinations of the animals by the recordings of the rectal temperature, then heart rate, then respiration rate, the mucous membrane color, and capillary refilling time. So give the better idea regarding the health status of the animals. So on the basis of this health status reports, so you can choose the animal is fit for the anesthesia, your animal fit for the surgery, or animal is unfit for the surgery, or animal is unfit for the anesthesia. So this decisions is generally on the basis of the clinical examinations and laboratory examinations. So if needed, the auscultation of the heart and lungs to note any unusual characteristics, and according to that you take the decisions. So not each and every animals come for the surgical interventions, perform the laboratory examination. But if there any doubt regarding the health status of the animals, it will depend upon the choice of the clinician. So following test, laboratory test provide the basic information regarding the fluid balance status, then hepatic and renal the function test, the nutritional status of the animals, and even the oxygen carrying capacity of the animals. So if you give the injectable or inhalation anesthesia, so oxygen carrying capacity is very important. So in the anemic patients, generally not recommended the inhalation anesthesia. Now last point is the fluid and electrolyte balance. So on the basis of the clinical and laboratory test to determine the dehydration status of the animals and the correct dehydration condition of the patients using the isotonic saline solution. So first to stabilize the patients, and after the complete stabilization of the patients, the correct dehydration, then you give the administration of the anti-anesthetic drug. So before the administration of the anti-anesthetic drug, stabilization is must be considered in pre-anesthetic evaluations. So now come on the general status of the animals. So general status of the animals will be evaluated by the clinical and laboratory examination of the animals. So this evaluations generally performed at a OPD level. So first to clinical examinations of the animals by the recordings of the rectal temperature, then heart rate, then respiration rate, the mucous membrane color, and capillary refilling time. So give the better idea regarding the health status of the animals. So on the basis of this health status reports, so you can choose the animal is fit for the anesthesia, your animal fit for the surgery, or animal is unfit for the surgery, or animal is unfit for the anesthesia. So this decisions is generally on the basis of the clinical examinations and laboratory examinations. So if needed, the auscultation of the heart and lungs to note any unusual characteristics, and according to that you take the decisions. So not each and every animals come for the surgical interventions, perform the laboratory examination. But if there any doubt regarding the health status of the animals, it will depend upon the choice of the clinician. So following laboratory test provide the basic information regarding the fluid balance status, then hepatic and renal the function test, the nutritional status of the. Now come on the second phase of the anesthesia, is the induction of the anesthesia. So what is the induction of anesthesia? It is referred to achieve the state of the conscious to the unconsciousness by using the injectable anesthetic agents, and followed by with the perform the endotracheal intubation to the animal. So the aims of the induction anesthesia. The one is to convert the conscious to the unconsciousness. So animal is convert conscious to the unconsciousness by using these drugs. And second one, after the complete desired the depth of the anesthesia, then you perform the endotracheal intubations for the easing the passage of the oxygens, even if the animal is connected with the inhalation anesthetic machine. So the means the passage of the oxygens with the inhalation anesthetic drugs. So endotracheal is generally performed for the safety of the patients. So this stage is again the subdivides into the four stages described below as the stage 1 is a voluntary movement, stage 2 is involuntary movement, stage 3 is a stage of the surgical anesthesia, and stage 4 is a progressive medullary paralysis. Means if you give the overdose, then animals enter into the overdose. So our aim to don't reach to the stage 4, don't reach to the stage 4, stop up to the stage 3, means the stage of the surgical anesthesia. So no need the detailed discussions about this, what is this different stage. You know very well, we already learned in the UG and PG levels. So how to achieve the induction anesthesia? So induction anesthesia is achieved by inducing the single bolus dose of the injectable general anesthesia using the ketamine, your thiopentone, your propofol, your etomidine, your alpha-zalones. So ketamines, through the ketamines, xylazine or ketamine diazepam is most commonly used drug in the field condition, but I will give some detail about the thiopentones and propofol. This is the most widely used induction agents in the canine all over the world. So these two drugs are the short-term intravenous induction agent and attain the popularity all over the world. So everybody, this drug is used nowadays in the world. But some more drug is also enter in our field, etomidine and alpha-zalones. So these two drugs are nowadays very costly, and this drug is generally safe for the cardiacs and unstable, hemodynamic unstable patients. So if any patient is hemodynamically unstable, even the cardiac patients, so you want to perform the surgery. So these are two drugs. These are the latest drugs. This is the latest drugs. So etomidine and alpha-zalone is the most commonly used in the human beings, particularly in cardiac surgery. In this webinar, I cover the two, mainly the short-acting induction agents. One is thiopentone and another is a propofol, and also give some brief information regarding the ketamine. Ketamine is the most famous, and everybody use this drug and aware about this drug. So first is a thiopentone. So thiopentone is the ultra short-acting barbiturate anesthetic drug available in the 0.5 grams and 1 gram vial in the dry powder form. So what do you mean by the ultra short acting drugs? So ultra short acting drugs means after administration of this drug as a form of the anesthesia, as a form of the induction anesthesia, to produce the short duration of the anesthetic period, short duration of the action. So within the 10 to 15 minutes, the finish your work. So within 10 to 15 minutes, you perform the enterotracheal intubations, and finally animal shift in the maintenance anesthesia. So duration of the thiopentone is very short, generally 10 to 15 minutes is a maximum 15 minutes work duration. So thiopentone having the rapid inductions, so these are the advantages of this thiopentone. Is very good muscle relaxations, work as an anticonvulsant drug because it is barbiturate group of the anesthesia is a work as an anticonvulsant drugs, but having some disadvantage of this drug means it is having the no analgesic property. So thiopentone is always preferred used with the pre-medication. So generally the opioid is add with the thiopentones, so to avoid the complications during the general anesthesia and recovery. So particularly in spayings and orthopedic surgery, so thiopentone is very good inductions as it gives the better muscle relaxations with the diazepam, your midazolam. So if you give the diazepam with thiopentone or midazolam with the thiopentone, so powerful muscle relaxations is noticed. In spaying is also very easily performed under these combinations. Generally 1.25 or 2.5% freshly prepared solutions is used in the canine practice. So how to prepare these solutions, 2.5% freshly prepared solutions? So these solutions is generally the prepared using the distilled water or normal salines. So these solutions never prepare in dextrose solutions because it produces the glucose effects, means the re-anesthetize the patient. So always add the distilled water or normal saline, but don't add the dextrose. So no entry of the NS in OT. So in our OT generally the NS is available, no DNS, no dextrose is allowed inside the OT. So it's produce the glucose, means once you add this glucose as a form of the dextrose, so infuse it, so chances of the animal re-anesthetize. So these are the glucose effect. Then how to prepare this 2.5% solutions? So 2 vial, 0.5 and 1 gram vial is available in the market. Suppose you want to prepare the 2.5% solutions from the 0.5 gram vial. So 2.5% solutions meaning, what is the meaning of this 2.5% solution? So very simple meanings. So 25 milligram concentration of the thiopentone in 1 ml of the solution. So simple meaning 2.5 means 25 milligram in 1 ml. So in 1.5 gram of thiopentone vial, add the 20 ml of the distilled water, or add the 20 ml of the NS and mix it. This makes the 2.5% solutions. And for preparation of the 2.5 from the 1 gram of the thiopentone vial, add the 40 ml of the distilled water. But in 1 gram vial, not possible to add the 40 ml distilled water, or 40 ml NS. So how to prepare the 2.5? So first to add the 20 ml of the distilled water and make the 5% solutions. So at the time of the induction of the dose, the half of the 5% solutions of the thiopentone load in the syringe, and same quantity of the distilled water is again add it and dilute it and make the 2.5% solutions. So very easy. So first to make the 5% solutions, and when you use it at the time of using, so load the solutions half, and half quantity is again add the distilled water, so automatically make the 2.5%. So this preparation of this 2.5% is from the 0.5 gram and 1 gram. So